For a fair and balanced debate, Congressman Jason Chaffetz of Utah and Congressman Joe Sestak of Pennsylvania. Gentlemen, good to see you. Congressman Chaffetz, the president is promising that his health care plan will not add a single penny, he claims, to the federal deficit. But if the cost is anywhere from $1 to $1.5 trillion, maybe more, is the president's deficit promise here just kind of wishful thinking at best and financially preposterous at worst?
Well, what he's actually proposing to do is raise taxes, nearly $1 trillion in new expenses. He's going to raise taxes. At the same time, he said 95% of Americans wouldn't get a tax increase. He is going to institute a tax increase. And I am just fundamentally opposed to a government-run, taxpayer-subsidized, Chinese-finance healthcare system that is going to essentially get government in between my wife and our doctor. We just can't do that.
Congressman Sestak, the president insists that we can save hundreds of billions by cutting unnecessary spending, increasing efficiencies. Are you skeptical that the government is capable of doing that? Because, you know, after all, for years, it's failed to cut waste, resulting in one of the most expensive per-person health care programs in America. That's the program for government workers.
Let me break his proposal apart. But first, let me say that President Obama is doing the exact right thing, because doing nothing is not an option. It's what we've done over the past 8 years, and 7 million Americans have lost their health insurance. An 83% increase in my state alone of health premium cost, while wages have only gone up 13%. So what has he done? He's made a very practical, businessman-like approach.
Which is?
About a month ago, the insurance companies and hospitals came to the president at the White House, said, we can cut 1.5% by increased productivity and efficiencies. The president said, I'll just take half of that, $100 billion, to help pay for it, just half. Then he said, number two, that we're going to cover everybody. So today we pay $106 billion for the uninsured and Medicaid. He said if everybody's covered, why pay twice? There's another $106 billion. And third, and this is my favorite, I'm a vet. A couple years ago when I would go into the VA, or if I were to, for an ulcer, the VA pays $250 for the ortonics for my ulcer.
Right.
But if you go to Medicare or Medicaid, you pay $1,200 to the same pharmaceutical. He said, let's make it fair. So there you have almost $300 billion. Good businessman-like approach.
But Congressman Sestak, let me stick with you for a moment. Your own Congressional Budget Office looked at the president's estimated spending cuts, and they basically said, we can't prove these numbers. They're flimsy. So how can we shape an expensive plan based entirely on cuts if we can't even estimate those cuts?
Correct me if I'm wrong, Greg. What they said on that was for his entire budget proposal that by 2018 it would be unsustainable. I agree with that. I agree with President Bush's is also. But in these numbers, where he said initially $600 billion for the health care reform, they scored that okay. But he also said it will take another $600 billion, and you, Congress, found it. We've been too worried to find it and too concerned. So he gave us another 300. We need another 300.
Congressman Chaffetz, fair and balanced here. Democrats, you were talking a moment ago about, no taxes. Democrats actually agree with you, including Chris Dodd. Today on Fox News Sunday, he vowed no to tax health care benefits, whereas some prominent Republicans want to do precisely that. They want to tax health care benefits. Since when does the GOP, which has a tradition arguing lower taxes, want to suddenly increase taxes, which, by the way, the vast majority of Americans are against?
Well, I think the president's own plan, if you look at it in its totality, the net is a tax increase. And when they talk about efficiencies, that's code for rationing health care.
But
and that's one of the scariest parts about
John McCain, Grassley today on Fox News Sunday, talking about taxing health care benefits.
No, I disagree with the idea and the notion that we're going to tax and spend our way out of this. I really do worry what the Democrats are putting forward is rationed health care. And when we put some government politician in between the decisions that my wife ought to be making with our doctor, then I think you've got a formula for disaster. And it's just absolutely the wrong direction to go.
Representative Jason Chaffetz, Representative Joe Sestak, thank you both.
Thank you
for having us.
All right, so now we want to hear from everybody.